When the team told me that we are going to be visiting this patient, I was thinking about how am I going to make this connection with this patient. He was very reclusive, he was very shy, he did not want to meet anybody, talk to anybody, because initially he was a very good looking boy, and after his chemotherapy he lost all his hair, so there was this body image problem and he didn't want to be seen that way by others. As you treat a lot of cancer patients, you realize that a lot of them cannot be cured, but there are a lot of symptoms that we still need to control, and we need to give them that quality of life for whatever remaining days they had. And this is what palliative medicine is all about.
My friend Rachel died in 2005. With that, I started thinking about how do children die when they have no means. The ward that I went through was filled with children who are just screaming in pain. And when I turn around to the doctor and say, why are the children screaming in pain? And she said, well, that's because they have no painkillers. Painkillers cost a lot of money, often about $10 for one shot. And that, I think, started me thinking, if we could eat for $10 a meal, then why can't we actually make that available to children?
Sebelumnya saya bekerja di suatu unit intensif, dan dari situ saya menyadarin ternyata ada hal-hal yang perlu kita ketahuan bahwa kematian itu ada. Dan itu kadang-kadang di lapangan seperti itu kita sebagai seorang perawat ada suatu hati mengatakan ini kayaknya nggak mungkin karena anak ini secara perjalanan penyakitnya tidak bisa disembuhkan. Tapi kenapa masih diusahakan buat sembuh dan diusahakan buat hidup? Anaknya udah capek.
When we started in Jakarta, there was only one palliative care doctor trained. As an ex-banker, I thought it was going to be easy. I thought, how difficult could it be? It was only when I started on the ground hiring our first team of nurses that I realized, holy cow, they don't know what palliative care is, and neither do I. I don't know how to teach. So when we realized that that was non-existent in Indonesia, I circled back and spoke to the doctors here and say help. And they then mentioned SIF.
It was tough because the nurses were very enthusiastic, but they did have some self-doubts. They were very hesitant because there was a lot of learning that they had to do, and it was a steep learning curve.
Kita memperkenalkan kita ada layanan paliatif, mereka nggak melihat sama sekali. Tapi dengan adanya SIF dan pelajaran dari 4 tahun berjalan, kita lebih pede lagi buat meluaskan paliatif dan menyuarakan paliatif di sini. Yang paling memuaskan adalah pasien menerima perawatan kita dengan yang benar-benar berharga bagi pasiennya. Mereka meninggal dengan tidak kesakitan dan berada di dekat keluarga yang dia cintain, dan keluarganya ikhlas atas kepergian pasien tersebut.
When I asked Raju what was his wish, what did he wish to accomplish in the time that he had?
He wants to make his parents happy.
Very good. That's a very good thing. You heard that, Mami?
Apa? Mau nyenengin ibu bapak ya, bisa membahagiakan ibu.
So there is an incredible trust because of the continuity of the team. So the SIF training actually brought credibility, that medical credibility to us.
So that's been the joy of seeing this team evolve, develop, and grow into a very, very confident team, which has gained so much respect, not only among the patients that they deal with, but in Jakarta, among hospitals.
Ini ilmu yang walaupun baru di Indonesia, tapi saya benar-benar harus meyakinin, belajar lagi dan belajar buat memberitahu teman-teman yang ada di luar sana kalau apa yang mereka lakukan bukannya salah, tetapi mereka bisa melakukan asuhan paliatif di tempat mereka bekerja.
So after the visit, the father mentioned that this whole meeting brought them a lot of peace and inner healing. I thought that was very, very touching as far as I could see, and I felt very humbled by that experience.
Beyond anything else, I think the SIF team or the volunteers who were brought in to teach our team is that medical care needs to bring back that human touch, and that you know, a patient is somebody who needs not so much as prescription, but that human being to come beside you and say, yes, I do care. And I think today that's what Rachel House leads with.